While thousands have perished due to deadly COVID-19 in past 6 months, the human spirit has not given into the expanding crisis and the fear it has induced. It has been constantly battling the disease. And if vaccine developers are to be believed, then we will have a cure for the virus in less than 90 days. Talking about South Asia, India is the front runner and has been working on multiple vaccine trials. The country, which has been praised globally for the manner in which it has tackled the pandemic, has not only decided to produce millions of doses in coming days, but is planning to build a robust health infrastructure to preempt future dangers.
From imposing one of the biggest and stern lockdowns to constantly ramping up the COVID-19 infrastructure, India has taken best foot forward in dealing with the deadly disease that has claimed nearly 800,000 lives globally. The country with the biggest population count after China, the alleged perpetrator has registered a recovery rate of over 71% with the fatality rate dropping below 2, a considerably lower number against fatality rate of 5. While densely populated South Asian countries like Pakistan and Bangladesh are not doing enough tests, India on the other side is very close to conducting 1 million tests per day. While New Delhi had allowed its Serum Institute of India, the world's largest manufacturer of vaccines by volume, to conduct clinical trials of a vaccine candidate developed by Oxford University. Prime Minister Narendra Modi recently apprised the nation about the multiple vaccine projects India was working on.
भारत में एक नहीं, दो नहीं, तीन वैक्सीन उसके टेस्टिंग के अलग-अलग चरण में है। वैज्ञानिकों से जब हरी झंडी मिल जाएगी, बड़े पैमाने पर प्रोडक्शन होगा और उसकी तैयारियां भी पूरी तरह रेडी हैं और तेजी से प्रोडक्शन के साथ वैक्सीन हर भारतीय तक कम से कम समय में कैसे पहुंचे, उसका खाका भी तैयार है, उसका रूपरेखा भी तैयार है।
Despite its massive size, the country hasn't faced any hospitalization crunch so far. The combined efforts of both government and citizens have ensured that COVID positives find both medical attention and isolation in time. From world's largest quarantine centers to private isolation wards, Indians have united in the fight against the pandemic. And amid mounting count, the country has now come up with the idea of revolutionizing its health sector. New Delhi aims to connect every Indian through a digital health card to minimize the problems people face during the treatment.
नेशनल डिजिटल हेल्थ मिशन, उसका भी आरंभ किया जा रहा है। भारत के हेल्थ सेक्टर में ये एक नई क्रांति ले आएगा। इलाज में आने वाली परेशानियां कम करने के लिए टेक्नोलॉजी का बहुत सुविचारित रूप से उपयोग होगा। प्रत्येक भारतीय को हेल्थ आईडी दी जाएगी। ये हेल्थ आईडी प्रत्येक भारतीय के स्वास्थ्य खाते की तरह काम करेगी।
India's flagship healthcare scheme, Ayushman Bharat, already provides a free access to healthcare to nearly half of its population. Meanwhile, the authorities have further eased on the restrictions that were put in place to stem the spread. The hotels that faced sustained lockdown owing to an overwhelming rise in the corona cases have now been green flagged to resume their services. Again, in the country's share market is also a sign that India is slowly but definitely returning to the social as well as economic normal.